will be led by the Premier of the Premier of KwaZulu-Natal, Sihle Zikalala, as well as joined by the MEC for Health, MEC Nomagugu Simelane. Without any further delay, I am going to be handing over to the Honourable Premier, who will take us through the message of today. Colleagues that want to make inquiries, those that are watching online, will, of course, as we have discussed, send their questions, which will be addressed later by the panel. And we will also give an opportunity to colleagues that are inside the hall. With that, we hand over to the Honourable Premier.
Thank you. Greetings to all of you colleagues. MEC, Simelane, Mr. Mabaso, and all government officials. Ladies and gentlemen, thank you very much to members of the media for heeding our invitation to this media briefing, for continuing to be the part of us in the fight against COVID-19, especially for being ears and eyes of the public when it gets to matters relating to COVID-19 and other important matters in the province. We have no doubt that when the history books are written, the immense contribution of the media in the eventual defeat of this deadly pandemic will be high up among the names of many of heroes and heroines. We commence our briefing today with an update on the effort to rebuild, reconstruct, and recover economically. Our economy has been negatively impacted by COVID-19 pandemic. The recent unrest have added to the downside risk and compounded our prospect for economic recovery. And as a result, investor confidence has been severely affected. This has had a dire effect on jobs and the economy at large. We have since put in place a comprehensive strategy to fast-track economic recovery. Part of the strategy is to restore investor confidence and uplift investment drive. During the past week, we had a series of strategic engagement in Gauteng with international diplomats representing more than 40 countries, as all of them, have committed to retain investment in the province and even pledge for new investment in future. This is a welcome boost for the KZN and an overwhelming vote of confidence in the economic fundamentals which defines the province as a conducive and preferred investment destination. We have intensified our rebuilding effort in KwaZulu-Natal through strategies such as social cohesion, advancing peace, and promoting social cohesion and moral regeneration at large. We have and are working with the religious leaders, traditional leaders, civil society organizations, and the business community to address the root causes of the unrest and the violence we have seen. The pillars of our provincial economic recovery in the aftermath of both COVID-19 and the civil unrest include the following: restoration of law and order, achieving stability and peace, providing a climate that is conducive for rebuilding and investment, devising strategies to detect and deter future unrest so that we are suitable and always prepared to deal with anything that might emerge. A coordinated approach that seeks to ensure that the economy can rebound back. Turning to the COVID-19 pandemic, it is with a deep sense of concern that we confirm that as KwaZulu-Natal province, we have been reliably advised by medical experts that we are now right in the third wave of COVID-19. The province has, for the past 3 consecutive days, recorded more than 3,000 new cases and is reporting the second highest number of daily confirmed cases. Our third wave appears to be due to the sustained increase in the rate of new infections. The surge in cases appears to have been driven in the main by one, the recent large gathering by people engaging in looting and destruction of property, an increase in inter-provincial travel, and a large gathering at pubs and restaurants, which we will deal with later. We've also noticed an increase in cluster cases, with schools emerging as the biggest contributor in this regard. In fact, more than 120 schools have reported clusters in their school settings, and more than 800 learners and teachers have been affected. Learners make up of at least 95% of this number, while educators account for the remaining 5%. In the latest 24-hour reporting cycle, our province has registered a total of 3,445 confirmed cases, which has pushed the total number of cases to 427,908. KwaZulu-Natal currently has 40,703 active cases of COVID-19 and has registered 12,535 deaths overall due to this pandemic. We are thankful that 373,806 people have recovered. Our province, nevertheless, remained the third highest in terms of laboratory confirmed cases, contributing 16% of the cases countrywide. The average number of cases recorded daily using the 7-day moving average was 2,518 cases per day. In the past week, the week 32, the province observed a 31% increase in the number of new cases. The province has also had an increase in the incident risk from 116 to 131 cases per day, or cases per 100,000 population. The increase occurred in 8 districts, with the exception of Amajuba, uThukela, and Umzinyathi, while eThekwini, uMgungundlovu, iLembe, King Cetshwayo, and Zululand observe a drastic increase in the cases. With regard to hospitalization, the number of hospitalizations is also increasing steadily in both the public and private health facilities, with some facilities reporting extremely high occupancy rate in ICU beds. The department is looking at alternatives in expanding ICU bed capacity. With regard to fatalities, with the rise in confirmed cases in the province, we have also noted an increase in the number of deaths. Over the past week, we have noted a 16% increase in the number of deaths as compared to the week before. The fatality rate now stands at 3%, with a mortality rate of 110 deaths per 100,000 population group. Hirigwala, Amajuba, Umkhanyakude, and Umzinyathi district have an even high case fatality rate at more than 4%. In terms of the mortality rate, Amajuba district stands at 174 deaths per 100,000 population group, followed by Umgungundlovu at 170 cases per 100,000 population group, and King Ichwayo at 120 deaths per 100,000. The number of deaths occurring at home increases on daily basis, which is also concerning because these are people whose life might have been saved had they presented themselves to our hospitals. The province, in terms of the province's response plan, in response to the upsurge of cases, we can indicate that there are still enough beds in hospitals. We have also retained a number of field hospitals that were being utilized during the first and the second waves. We have also established a roving team of highly skilled people such as epidemiologists, public health specialists, medical experts, infection control experts, and nursing professionals to assist the districts that are experiencing a surge in cases. We are also continuously assessing fatality readiness with the support of partners such as World Health Organization, United States Center for Disease Control, and the National Department of Health, which we appreciate a lot. With regard to oxygen, our oxygen capacity is also continuously being assessed in order to identify pressure points and ensure early interventions where necessary. We are urging citizens of the province to go to their nearest health facilities if they are not feeling well, in order to reduce the number of home deaths and patients dying on arrival at our healthcare facilities. We also want to stress once again that compliance to non-pharmaceutical measures such as the wearing of masks, regular hand washing with soap and water, and social distancing remain key. We also wish to take this opportunity and welcome the recent finding by the South African Health Products Regulatory Authority to the effect that there is no reason to worry about the safety of COVID-19 vaccines that are being used in the country. We will remember that this regulatory body had received 2,033 reports of adverse events following immunization by certain people. However, most of these complaints were not serious, and SAPRA then began an investigation into 29 cases of deaths that occurred shortly after people had received the COVID-19 vaccine. Up to this point, these investigations have been completed, and it has been found that the 29 deaths were not related or linked to the vaccination. We are relieved, and we feel quite vindicated by these findings, as we have always maintained that the vaccines that are in use have undergone rigorous scientific testing. It must be said, though, that when safety concerns first arose about the vaccines, we started seeing a decline in the number of people who came forward to vaccinate. Suddenly, people started staying away. Therefore, we hope that with these findings, people will start coming back in large numbers to get vaccinated, so that we can continue with our important journey toward achieving population immunity. We are vaccinating about 30,000 people per day. In order to reach the target of 7.2 million vaccinations by the 31st of March 2022, we need to vaccinate at least 60,000 people per day. We are also, therefore, urging our fellow compatriots to come in large numbers and get vaccinated. We have the necessary capacity, and the vaccine supply for this is available. The ball is now in our court. We would want to emphasize this point. It is important that we encourage and get as many people as possible to get vaccinated. We are aware the MEC is considering rolling out vaccination even to public facilities such as taxi ranks and others to ensure that more people are vaccinated on a daily basis. I'm quite sure many people are also envious of European countries that we see on TV, where people no longer wear masks, where people go and attend football matches, for instance, and are now able to go back and attend all activities. It can also happen here if we all get vaccinated. It has been brought to our attention that a number of trade and a number of pubs and restaurants are floating level 3 regulations by letting in a large number of people into their establishment. This seems to intensify as the clock ticks closer to 10 p.m. Kuthiwa liyabhubha la kuma restaurant, and people are getting nje bagcwala emgwaqeni all over ukuthi mase kugcwele ngaphakathi baphume babe ngaphandle kwama restaurant. We are very concerned. Most of these are young people who congest in these places, and we are told that there is no regard for social distancing. It appears that owners of these pubs and restaurants have lowered their guard and are now conducting full-scale super spreader events. We want to remind them of the regulations that are in place as part of adjusted level 3 of the national lockdown, which state very clear that such establishment may only have 50 people indoors and 100 people outdoors. There is still a curfew in place, which also means that you operate from 4 a.m. to 10 p.m. We have instructed the security cluster to look closely into this situation. We warn and we are sending a strong message, a strong warning to all business operators and indeed patrons themselves to respect the law. We want to be clear. We are going to take a hard line against those who undermine the regulations. We really do not want a situation where we are forced to revoke people's trading licenses and shut them down, as this will worsen an already tough situation. We hope it will not come to that point, because we want to see everyone succeed and recover from the effect of COVID-19 and the recent unrest. The increase in number of daily cases per week is a clear indication that we are not yet out of the woods and should therefore not let our guards down. The transmission level is very high and concerning. This means the chances of infected people spreading the virus to the other people is still very high in the province. We wish to emphasize as we conclude that the need for all of us to avoid super spreader events that lead to outbreak, that is very important. We need to ease the pressure on our hospitals and our health workers who have been fighting COVID-19 for the past 17 months. Let us ensure that everyone is vaccinated and continue to adhere to non-pharmaceutical measures. I thank you.
Thank you very much, Honourable Premier. Without any further delay, we are going to go straight to questions. And for a change, I'm going to start with the online questions. I've got one from the Sowetan, Penwell Damini. who's asking, I think what Premier has partially touched on, regarding the slow pace of vaccination. Is asking about what are the measures in the province to ensure that vaccination is accelerated, especially considering accessibility in some of the rural areas. That's a question from panel Lameni. Is there any other question online, colleagues? Let's take the colleagues inside the house. Sisters, any other hand? You'll be next, sir. Okay, let's take those two first. Thank you. We'll go to the next colleague. Thank you. We'll hand over to the panel. Take the final round.
May I take this last question because the rest will be addressed by MSc Nomagugu Simelane. Floating regulations. No, we will not call for a reversal to level 4, but we are going to enforce compliance. We are going to be very hard on those who undermine the regulations. As we say, there is still a curfew, and people must operate from 4 to 10. There is still regulations that only 50 people in regulations must be followed as such, and only 100 outdoors. We will be dealing with areas where business and restaurants in particular, as well as pubs, are undermining these regulations, and we will be hard on that. We are not going to relent on that. Thanks.
Thank you, Premier. We hand over to Ramezi.
Good. Ladies and gentlemen, thank you very much for coming. Good afternoon to the Premier and the colleagues. I do not have a lot of questions, but let me indeed start with a question that was asked online on whether we have strategies of ensuring that people come back and come and vaccinate. I believe, Mr. Mabaso, that was the question. It also implied that there was an issue of access of vaccines in the province. Let me start with the last point. We do not have a challenge of access of vaccines in the province. We have more than enough in our facilities. We have more than enough in the whole province, which would include your rural areas. So we do call on people to actually come and get vaccinated. That we have heard in the last week or so is what the Premier was indicating, that we had seen a decline in numbers of people that actually were coming to vaccinate. And that is what we were worried about, and hence the Premier has given us a report from SAPRA on the 29 fatalities that were reported to the regulatory body, and an implication at the time was that they passed on because of being vaccinated. And of course, the report we are receiving from SAPRA is that it is not the case indeed. we found that that report, when it initially came out, it did make our people, or it did make communities, or some communities, to worry a little bit, and as a result, our numbers of people who were vaccinating really went down. So we do have enough vaccines throughout the province. Of course, we have also embarked on a number of different strategies on how do we ensure that our communities get vaccinated. One of them is the drive-through campaigns that we have. We have started with it in King Cetshwayo municipality, with Umhlatuze municipality, where people come in their own cars, they don't have to get out. Our own health workers actually just go to their cars and they vaccinate them at that point. So it is something that we are working on, and we will be rolling out in the rest of the province, particularly in urban sites where we have enough space for us to be able to run a program like that. We have found that it's extremely exciting, and you find a lot of people that are interested, and they come and get vaccinated, because some people don't come to our vaccinating sites because they think they might get infected by just sitting there and waiting for vaccines. So this drive-through program, they cover those, and they ensure that those that are worried, they actually are catered for. They actually established or came up with a number of programs. One of those programs is a program that we are calling an influencers program, where we visit different areas and we have influencers who firstly get vaccinated themselves, and then they start talking to the different communities that they are engaging with, and ensuring that they pass the message. How do they feel? They're vaccinated? Are they having any adverse effects, and so forth? The latest one program that we had was with Ikakas FM, which is one of the big stations in KwaZulu-Natal. The whole, or the majority of the workers there came and were vaccinated, and they were able to actually speak to the communities through their shows and indicate what has actually happened and what participated while they were vaccinating. And we are calling on everyone. We don't have a particular partnership with one sector. Any other person who is an influencer is more than welcome to come and work with us. We would love to go with the majority of the community radio stations. We'd love to go with any radio station. When I say the radio station, I'm not just talking about one person who is a commentator there, but the whole management, so that everyone is safe. So we are working on having those kinds of partnerships that we will be implementing. We have been talking to, or we have also been taking the different MECs together with the Premier to go and vaccinate with the leadership of the particular district that they vaccinate in. And we have found that the leadership is often quite excited, because you would then have Amakosi in the area, you would have your religious leaders, you would have your traditional health practitioners participating in the program. It is quite exciting. This week we are going to be vaccinating with Deputy Minister Nzuza, who actually comes from the province of KwaZulu-Natal, and he is going to be part of our program. So we have found that a lot of people are coming up and are saying, use my stature to be able to influence other people, and that's what we are going to be doing. I just thought, let me speak to that, Mr. Mabaso, so that we give a bigger picture on what are the other programs that are there. Sihle, you were asking about a particular shop that has issued discounts, and whether we as the Department of Health agree with that. Let me firstly indicate and insist that vaccinating is not compulsory, and it would be unconstitutional for us as a department and as a country to force anyone to vaccinate. As a result, that is why a few months back I would give a report that about 60 or 70% of our health workers have vaccinated. Of course, that number has now increased because they keep on coming. It's purely because we cannot force anyone. Everyone has a right to their own religious beliefs. Everyone has a right to decide whether they want to participate or not. Of course, we encourage people to come. So when shops say they are offering a discount, it is not in partnership with the Department of Health, but I believe they are trying to play their own role as community leaders to try and assist government in ensuring that they encourage people to go and vaccinate. The important thing for us is that whatever shops that are having these adverts are not saying you will not come through our doors unless you have vaccinated. And they are not saying we will not sell you anything unless you have vaccinated. Because had they been doing that, then that would really go or fly against the Constitution. When they say it's a discount, well, you know, a discount in any shop is at the mercy of the owners. And maybe at some point when we engage with National, we might be able to get a proper sense of what is the take of National on the matter. But so far, it is what they are doing, and we believe they are trying to assist government in getting as many people as possible to vaccinate. The issue of J&J being a problem when it comes to the patients that have clots or the patients that are clotting generally. Let me start by saying any patient any patient that comes to the Department of Health to vaccinate is always asked about their comorbidities, is always asked about their previous medical history. The intention of that is so that the clinician or the nurse that is sitting in front of them at that particular time is able to provide proper advice. Because it might not just be J&J, even Pfizer, depending on what comorbidities I have as a person, might have an adverse effect if I have not been given proper advice. So the intent and the reason why we also have doctors in our different vaccination centers is so that that kind of advice is given properly. So any person who comes to our vaccinating site are firstly asked about their medical history, and they are given proper advice on whether they should proceed with this vaccination, yes, or the other, or they should not vaccinate at all. For instance, you would find that some people will come into our facilities and they would have flu-like symptoms, and you find that they have not tested, well, they don't know whether they are COVID positive or not. And we would then say to those, please go and test first, so that we know that you are not positive, you are not COVID-19 positive. Then, only then can we be able to vaccinate you. So I would not want to target a particular brand of a vaccination, but I want to confirm and assure our people that when you get to the vaccinating site, please also disclose your own medical history. If you have concerns, if you have worries, speak to the person in front of you. They will indeed provide you with the correct advice on how to proceed moving forward. Thanks, Mr. Magas.
Thank you, Missy. Is there any other question, colleagues? Second bite, last bite.
My last one to the MEC. Ngabe sizobona livulwa isibhedlela lapha eMegas eBritain kwamashu, because people have been looking forward to see officially being open. Thank you.
Okay, thank you. The last one that we have online is coming from independent media. It's directed to the Premier. It's requesting the Premier to comment on posters about shutting down all government institutions on the 23rd of this month. Which was emsebenzini will be dealt with harshly. Police station, municipal offices, and other government institutions. Last time kwenzeka lokhu ama voice notes akunakwanga sasithola sisenkinga. So that's the long and short of this question. I think it's also been asked by Bongani Gina, Kakas FM. We'll request the MEC to respond, and then the Premier will come in and respond to his questions, and then also summarize in his Zulu. Thank you.
Thank you, Mr. Mabaso. Sishila siyabonga kakhulu. Isibhedlela sethu esibizwa ngokuthi iPixlika Isakaseme Memorial Hospital has indeed started ukusebenza. Ukusivula officially sizosivula towards the end of unyaka uma ngabe undunankulu noma ngabe lisebe available sesenza an official handover. Kodwa angichaze ukuthi ukuqala kwethu kusebenza ePixley sidecide ukuthi sizokwenza ngama phases. Into eyenza ukuthi sithathe leso sinqumo ingoba sisibhedlela esisha lesi esinama systems amasha onke esine staff esisha sonke. So kubalekile ke ukuthi uma ngabe uqala ukuvula isibhedlela esinjalo ungaqala usivule sonke isibhedlela kanye ngoba if you do that lento ebizwa ngokuthi M&E uzongakwazi ukuyimanage kahle. Kanti uma sisivula ngama phases siyakwazi ukubona ukuthi la kule phase yokuqala inkingi bekuphi, ama systems ethu ayasebenza yini, asebenza kahle, kufuna sishintsheni, i-patient flow ihamba ngendlela ama clinicians athanda ngayo yini, and then what do we do uma ngabe kungenjalo. But I must confirm ukuthi i-process ye recruitment isiphelile yonke. I-management isi appointiwe, laba bantu akade be interviewer for all the other categories ezi-clinical nezingekho clinical, that process isiqediwe. Now immediately ke uma ngabe isiqedwa njengoba siqala uAugust nje abaningi babo because bazobe besebenza kuhulumeni for the first time kufuna ba undergo iprocess ebizwa ngokuthi induction process ngoba na usebenza kahulumeni ungakazi usebenze khona kufanele ube nayo iprocess ikhona itraining ebakhona yokukhombisa ukuthi kuhulumeni kusetshenzwa kanjani. So kule nyanga ke sizobe sibhizi nalokho kule nyanga nenyanga elandelayo, kodwa sesiqalile iphase yokuqala nje sivule i-unit ye-radiology iqalileke iyasebenza. Now into eyenza ukuthi sifune ukuthi sivule ngama phases ingoba ePixley esinye seyibhedlela sethu esithi nasisebenza esithena sisivula sathi sizoba paperless, sizosebenzisa le system esasikhulume ngayo noma esasi introduceile ngesikhathi sine budget speech esibiza ngokuthi i-health system. So kufuna ke sikwazi manje ukulinka leyo system leyo e-health system siyibona ukuthi isebenza kahle esibhedlela, siyibona ukuthi iyasebenza nawo wonke amanye ama gadget, nawo wonke amanye eminye imishini esinayo esibhedlela. So we've started ke ngalokho. Ama patients esiwabonayo currently ePixley ama patients esiwathatha kwezinye izibhedlela eziseduze. Ngamanye amagama ama patients ethu awakabi ama patients avela ayifikele nje esibhedlela. Lokho sicabanga ukuthi sizoqala ukwenza kahle towards ekuqaleni kuka October. We'll then start having ama patients that are walk-in patients. Kodwa uAugust wonke no September wonke sizobe sivula ama units ngama phases onke lawa khona. Une radiology, you know, you have a lot of other units akhona esibhedlela and azobe qale sebenza. Le radiology mhlambe isina 3 weeks iqalile ukufunctiona, okusho ukuthi nestaff esisebenzayo yistaff esibhekelele that particular unit. In the kule viki esizoliqala sizobe sesithola noma bakhayo bazobe sebeshandovela amanye ama units siqale futhi siwasebenzise nawo siwabuke sibheke nesystem ukuthi ihamba kanjani. So in summary sesiqalile ukusebenza kodwa sisebenza ngama phases, but abantu esibabonayo ePixley akusiba abantu abazovele bagule nje beze khona okwamanje. Sisasiza izibhedlela lezi eziseduzane so that nathi sikwazi ukubona ukuthi kukuphi lapho ekudinga silungise khona, so that by the time sithi wonke umuntu ke manje useyakwazi ukungena esibhedlela singayitholi sinenkinga ngelinye ilanga kuthiwa isibhedlela sivaliwe ngenxa yokuthi amanzi awahambi kahle noma ugesi awuyi lapho kufuna iye khona noma isystem yethu ye health ayikho functional. So we are quite excited kodwa I must say si happy ukuthi isibhedlela sesiqalile siyasebenza and kuyasikhombisa ukuthi ikuphi lapho kufuna silungise khona and siyalungisa very quickly then siqhubekele phambili. Ngiyabonga Mr. Mabaso.
Thank you, MEC. Let's invite the Honorable Premier. Another question and summarize in Zulu.
Thanks to the MEC for clarifying issues that were asked. There is a question from, I think it's Gagasi as well as Independent. We would want to respond direct firstly, we don't want to be detracted by fake news. But secondly, we are not taking anything for granted. We have received, and some people have reported also, about the posters that are in the social media saying that on the 23rd there will be a shutdown. And we have reported this to law enforcement agencies, and we believe they are ready for that. And we would want to assure all people of KwaZulu-Natal that there is no such a shutdown, and we would want to ensure them and guarantee the safety that the police and other law enforcement agencies will be all over to protect them. It is a normal working day. The 23rd is the normal working day, and we don't want to be detracted by anything. NgesiZulu sizwile ngembiko ethi kunama posters athi kune shutdown ngomhla ka-23. Njengohulumeni sesirikwa engagile sawabikela amaphoyisa nabo bonke abaphethe umthetho ukuthi bakwazi ukuzilungiselela ukuthi sivikele abantu bakwaZulu-Natal nengqalazizinda nakho konke namabhizinisi. Siyafuna ukuqinisekisa ukuthi umhla ka-23 usuku olunormal, usuku lokusebenza, i-security soqinisekisa ukuthi isesimeni, but siyafuna ukuthi futhi singade siphambaniswa into eyivela kwi-social media, kodwa akusho ukuthi sizothatha izinto for granted. Sizoprepare siqinisekisa ukuthi siyakulungiselela ukuvikela abantu beprovince ukuthi amabhizinisi aqhubeka asebenze ngokujwayelekile, izikole iqhubeke isebenze, ama-ofisi kahulumeni asebenze ngokuyikho. Uma ngibuyela ku ngqikithi namuhla siyafuna ukuqala sibonge abezindaba ngokuqhubeka njalo bebamisana nathi ekutheni sikwazi ukucacisela abantu bakwaZulu-Natal ngesimo sokulwisana ne-COVID-19 nangezinye izinto ezibalulekile. Siyafisa ukuthi sibathulele isigqoko beyindaba. Siyakholwa ukuthi mzukwane umlando wokulwa nokunqotshwa kwalesi sifo sobhubhane i-COVID-19 iqhaza labezindaba liyobalulwa li-highlightwe njengelibe negalelo elikhulu. Uqala nje i-COVID-19 kanye nezidubedube lezi esibe nazo ngoJulayi kulimaze kakhulu umnotho wesifundazwe sethu. Njengohulumeni sinohlelo oluphelele lwestrategy lokulwisana nalesimo esibe kuso sivuselele sakhe umnotho ngokuqinile. Yingakho ke kuleli sonto esivela kulo sambele ePitoli la sihlangane khona namanxusa amele amazwe angaphezulu kuka-40. Sikhuluma nabo sibabriefa ngesimo esibhekene naso, sibuyisa futhi ithemba. Siyabonga ukuthi bonke bazinikele bavuma ukuthi bazosebenzisana nathi. Bavuma ukuthi zonke inkampani ezikhona KwaZulu-Natal bazobamisana nathi ukuthi zivuselelwe ziqhubeke isebenze, kodwa futhi bazoqhubeka banxenxe neinkampani ezingaphandle ukuthi zize KwaZulu-Natal. Siyafuna ukuqinisekisa uhlelo lwethu lokuvuselela umnotho luphelele, lubheka zonke izinto. Uhlelo lokuqala kumbe okokuqala nje kulolu hlelo ukuthi siqinise ukusebenza komthetho, restoration of law and order. Okwesibili ukuthi sakhe izinkundla zokuxoxisana ukuze kube khona ukuthula nobumbano nokubambisana ebantwini. Okwesithathu ukuthi sikhulise umnotho ngokunxenxa amabhizinisi ukuthi aqhubeke asebenze nangokunxenxa i-investment ukuthi kube khona abatshali izimali abezayo kwiprovince. Okwesine ukuthi sikwazi ukubheka la sibona khona ukuthi ngase kube neyingozi eziphazamisa ukuthula nenhlalakahle yabantu bakithi, singenelele ngesikhathi. Okugcina ukuqinisekisa ukuthi zonke izinto nemikhankaso ekhulisa umnotho i-implementwa ngokusheshsha nangendlela ehlangene edidiyelwe ukuze sikwazi ukushesha ukubuyisela umnotho esimeni esiyiso. Uma ke sizobuyela odabeni lwe-COVID-19 okuyingqikithi yale media briefing yanamuhla, sikhathazeke kakhulu njengekwaZulu-Natal ngoba ngokwembiko ekhona seqinisekisiwe ukuthi KwaZulu-Natal isiphakathi kwe-third wave yalolu bhubhane lwe-COVID-19. Kumanje ngosuku sithola abantu abasha abahaqekile ababa ngaphezulu ka-3,000 ngosuku. Sithola ukuthi indawo eyihlanganisa abantu babe baningi yizo eyikhanda ukuthi kusabalaleke ngokushesha ukutheleleka kwabantu ngalolu bhubhane. Lokhu kusukela ekutheni indawo eyifana nalabo ekuluthwa khona uthola ukuthi abantu bayazitapela impahla kushiswe izinto ibe ingxenye yama-spreaders, ama-super spreaders. Okwesibili, ukuhamba kwabantu besuka kwamanye ama-province beya kwamanye. Okwesithathu, yilabo abama-restaurant nama-pubs asebenza kuze kube late. Kusiphatha kabi-ke nokuthi iy'kole nazo zibonakala zikhungatheka zihaqwa ilento ye-COVID-19. Iy'kole engu-120 kumanje zi-affected, kanti uma sibala nje abafundi nothisha abawu-800 bahaqwe lesi sifo, u-95% abafundi kanti othisha ba-5%. Siyaqhubeka nokuthi simonithe ama-cases. Lapha KwaZulu-Natal ama-cases are-active kumanje angu-40,703, kanti okubuhlungu ukuthi abantu esebedlulile emhlabeni bangu-12,535. Siyabonga nokho ukuthi abantu abangu-373,806 bakwazile ukurecover kulesi simo. Kusiphatha kabi ukuthi nezinga lokushona kwabantu liyalenyuka ngenxa yalesi sifo. Siyaqhuquzela ukuthi abantu bahambele izibhedlela uma bezwa ukuthi abaphilile kahle. Siyaqinisekisa futhi ukuthi imbhede ne-occupancy rate sisekahle kakhulu. Abantu uma bezwa ukuthi abaphilile, ikhona imbhede, iy'namba zikahle, bangakwazi ukuthi bathole ukuthi basizakale ey'bhedlela. So sithi abantu uma bethola ukuthi abaphilile abasheshe baphuthume. Siyazi ukuthi i-first wave ne-second wave kwasiphatha kabi kakhulu la KwaZulu-Natal. Yingakho-ke kumanje sesinohlelo lokubhekana ngqo nalesi simo sokunyuka nokungena kwi-third wave. Sesikhipheke ukuthi siqinisekise ukuthi ososayensi nabazi kabanzi ngokulwisana nalesi sifo babe yingxenye yokukwazi ukutholakala kuwo wonke ama-district ngokushesha. Sisebenzisana ngokubambisana ney'nhlangano ey'fana ne-World Health Organization, US Center for Disease Control kanye ne-National Department of Health esibabongayo ngosizo lwabo nokusilekelela. Asiqinisekise futhi abantu bakithi ukuthi i-oxygen ikhona ey'bhedlela and izinto ezithi mhlawumbe uhulumeni akekho esimeni sokudila nalesi simo, hhayi azilona iqiniso. Sisesimeni futhi sizokwazi ukuthi uma sibambisene siyiKwaZulu-Natal sisinqobe lesi sifo. Siyagcizelela-ke nokho ukuthi kubaluleke kakhulu ukuthi sizivikele. Ukuyivikela kusasele khona ekutheni siqhubeke sisebenzise ukufaka ama-mask, siwashe izandla ngamanzi nensipho, silandele imiyalelo yokuthi siqhelelane uma sisey'ndaweni eziba nabantu abaningi. Ngiyafisa ukugcizelela ukuthi imbiko evela kwi-South African Health Product Regulatory Authority iyasiqinisekisa ukuthi imigomo ekhona yonke ayinabo ubungozi. Kwaba nama-report adluliselwa kuyo iSAFRA ukuthi kunama cases abantu abangu 2033 abashone ngenxa yalesifo. Kodwa uma sekuphenywa kwatholakala ukuthi bangu 29, kwaphenywa kulama cases awu 29, kwatholakala ukuthi ukudlula kwabantu laba abangu 29 kwangahlangene nokuthi babegomile. Sithi ke sonke masibambisane masiphume siyogoma. Uma nje KwaZulu-Natal igoma abantu abawu 30,000 ngosuku, kanti uma sizokwazi ukufinyelela kwi-target ka-31 March 2022 kudinga sigome okungenani abantu abangu 60,000. Siyacela-ke ukuthi wonke umuntu ongakagomi aye kogoma. Siyazibonga futhi siyazincoma izinhlelo zomnyango waka-health zokusebenzisana nabantu abangosaziwayo nalabo abangabaholi ukugqugquzela ukuthi kugonywe. Ngiyafisa ukugcina ngokubuyela odabeni lokuthi sonke masilandele imigomo. Okwenzekayo ey'ndaweni lezi zobumnandi, ama-restaurant nama-pub la uthola ukuthi kuyavulwa kuze kudlule u-10 kumbe kuhlalwa ngendlela engahambisani nemigomo, akumukelekile futhi sizodila nakho ngendlela ezothanda ukuqina kakhulu. Asifisi ukuyibona sifinyelela esimeni la sophuca khona abantu ilicense zokuthi badayise okungakhanda kubuyisele emumva umnotho. Kodwa uma kuphoqa kuzofika lapho, ingakho-ke sikhipha isixwayiso sithi bonke abantu abalandele imigomo ebekwe uhulumeni yokuthi silwisana kanjani nalesi sifo. Umgomo uclear, setshenzwa between 4 ekseni kuya ku-10. I-curfew ayilandelwe. Uma kungukuthi indawo ingaphakathi, abantu abangabi ngapheka 50 abakhona, nakhona bakwazi ukushiyelana ibanga elifanele le-social distancing. But nangaphandle abantu abangabi bameningi iziquku kumbe babe ngaphezulu ka-100. Sithi-ke kubo bonke abaphethe iy'ndawo ey'dayisa ukudla ney'dayisa iy'phuzo akulandelwe imigomo injalo. Asifisi ukuthi kuze kufinyelele esimeni sokuthi kube nabantu esiwithdrawa ama-license abo. Siyabonga.
Thank you very much, Honorable Premier and Honorable MC. We'll adjourn it at this point. Thanks to colleagues from the media and colleagues from the OPP. We adjourn at this point. Till next time.
Siyabonga.